Hi teacher, I'm going to talk about the Papilomavirus. General description. HPV infection is a viral infection that commonly causes growth on the skin or mucous membranes. There are more than 100 variants of the human papillomavirus. Some types of HPV infection cause worse and others can cause different types of cancer. Most HPV infections do not lead to cancer, but some types of genital HPV can cause cancer of the lower part of the uterus that connect to the vagina, cervix, other cancer, including cancer of the anus, penis, vagina, vulva, and back of the throat or pharynx, have been linked to HPV infection. These infections are often transmitted sexually or through other skin-to-skin contact. Vaccine can help protect against strains of HPV that are more likely to cause genital warts or cervical cancer. Symptoms. In most cases, the body immune system defeats an HPV infection before creating warts. When warts appear, they vary in appearance depending on the type of HPV that's involved. Genital warts disappear as flat lesions, small cauliflower-shaped bumps, or small staph-like bumps. In women, genital warts appear mainly of the vulva, but they can also appear near the anus, on the cervix, or in the vagina. In men, genital warts appear on the penis and scrotum or around the anus. Genital warts rarely cause discomfort or pain, although they can itchy or tender. Common warts. Common warts appear as raised bone and usually occur on the hands and fingers. Plantar warts. Plantar warts are hard, grainy growths that usually appear on the heels or the balls of the feet. Flat warts. Flat warts are flat, slightly raised lesions. Cervical cancer. HPV infections are the leading cause of cervical cancer, but cervical cancer can take 20 years or more develop after an HPV infection. HPV infection and early stage cervical cancer usually do not cause notice symptoms. Getting vaccines against HPV infection is the best protection against cervical cancer because early stage cervical cancer do not cause symptoms. It is vital that women have regular screening tests to detect any precancer chance in the cervix that could lead to cancer. Current, current guidelines recommend that women aged 21 and 29 get a pus test every 3 years. Women aged 30 and 65 are advised to continue getting a pus test every 3 years or every 5 years. If they also have HPV DNA testing at the same time, women over 65 can stop testing can stop testing if three past tests in a row have normal result, or two HPV DNA tests and two bad tests with not abnormal result. Cause: HPV infection occurs when the virus enters the body, usually through acute abrasion or a small tear in the skin. The virus is spread primarily by skin-to-skin contact. Genital HPV infections are spread through sexual intercourse, anal sex, and the other contact in the genital region. HPV infection does cause oral and upper respiratory lesions and contract through oral sex. Worse are contagious. There can be spread through direct contact with a word. Worse can also spread when someone touches something that has really touched a word.